a, not a hangout, but a video with Nick Olo from San Diego for the Better Birth 360 um, set of webinars. And the topic of that discussion was informed consent. And I kind of wanted to take today and do a little bit more about informed consent because I think sometimes, expectant parents want shorter classes, more concise classes, and the educator really wants to keep all the important topics, and she's challenged with presenting them with different strategies in order to meet her time constraints, including using social media, which we're really ramping that up here with ICEA. We've done a lot of things in the last 6 months to try to reach our members in different ways. But sometimes topics are just simply cut from curriculums for the childbirth educator. And I think that one of the most common topics that's cut is informed consent. I don't think that a lot of people cover it as much as they used to back when our classes were like 5 or 6 class sessions in a series. And if you've read the tagline for ICEA, you know that informed consent or informed decision making is at our very core. Our tagline says freedom to make decisions based on knowledge of alternatives. And one way to teach informed consent is through those simple questions. These questions can have acronyms attached to them so that they're easier for people to remember. A lot of people call that a memory hook. Kind of like taco or coat for when you talk about the amniotic bag breaking, or but with informed consent, you can take a lot more in-depth look at the non-pharmacologic and the pharmacologic pain relief, as well as medical and mechanical inductions as you look through these acronyms. Acronyms such as BRAN, which is benefits, risks, alternatives, what does your instinct tell you, and then what if you do nothing. There's also one called BRAN, B-R-A-N, which is benefits, risk, alternatives, now decide. And there's BRAND, which is benefits, risk, alternatives, what if I do nothing, now decide. So the D is now the decide piece of the acronym. And when you look at studies of mothers' satisfactions with their birth experience, it's not so much that they've become so satisfied because they've had a natural or normal or physiologic birth. It's more that the top satisfier becomes they had a significant part in the decisions that had to be made during the labor and birth. So she knows her voice, she knows how to use her voice, and she uses that voice to help make decisions with her and her caregiver. And we have to remember that most of the time, birth is an uncomplicated life experience. I think the World Health Organization quotes 85% of the time it's not complicated, and only 15% of the time does it actually need any kind of intervention, or it becomes complicated. So I think we have to keep that in mind too a little bit. So where can parents actually find information that they can use in their decision-making process? First of all, we have to have mom understand that when she makes that informed decision, especially if it's a refusal for a certain intervention or procedure, that she does have responsibilities, and and she also needs to know the responsibility of her care providers. None of this takes place without key conversations with care providers. I think that's huge that we encourage our expectant moms and their partners to have that kind of a trusting relationship with their care provider and to actually talk with them. Not having one person talk at the other person, but actually having conversations. So back to where parents and professionals can find the most current evidence-based information. Well, contrary to popular belief, everything you see on the internet or see on TV, it may not be evidence-based and it may not even be true. One teaching technique that can be applied here to help parents figure it all out is to provide them with a list of go-to sources so that they can read some of the things for themselves. Now, when someone reads or when someone reads or views a video, that will only validate stronger what the doula or the educator says. We can talk all day about a certain thing, but then when one other person says it or two other people say it, then all of a sudden we become validated. And so our clients can really own that information. So making a list of different books, making a list of websites that have the most current information, the most accurate information, and then maybe also talking to them about how to discern whether something is accurate. Maybe look at that website or that blog and see if the person that wrote it actually referenced the thoughts that she presented there or that he presented there. And so the list can be a handout, it can be posted on Facebook, it can be a PDF on your website or your blog. I hope everyone is familiar with the fact that we have completely updated and revamped all of the ICEA position papers last year. That was the first step that educators can have in updating their education on current topics. Those are all heavily referenced. They've been edited. They've gone through an intensive process to make sure that they are completely up to date. So we have many of the position papers, and there are more that will be added later this year and then again next year. We've also begun adding white papers, which are not exactly position papers, but they're more informative, informational type pieces that we've found on different topics. And then also we have policy statements on some things where you can go and you can read the information, and we suggest that this might be the way that you want to think about it. Of course, you're always make an informed decision and figure it out. We have a mechanism in place where, again, the white papers and the policies are reviewed and updated on a regular basis. So you can be assured that in every 3 to 5 years, everything is going to have different information, more updated information, more current information there. So basically, the topic of informed consent is not only applicable to labor and birth, but almost to any life situation. I mean, you could take your car to the mechanic and he says, well, I think you need new brakes. And you can say, well, what are the benefits? Well, obviously, the benefits, but what are the risks of not replacing the brakes? Well, maybe the rotors are going to have to be redone. Are there any alternatives to that? What does your gut tell you? Maybe not today, but maybe next week you can afford that or whatever. So anytime you're doing any decision making, and this can be at the doctor's office, it can be at a dentist's office, it could be with the child at the pediatrician, you can base your decisions on these 5 simple questions. And I'm not sure if you know that there is actually an informed consent decision-making form on the ICEA website. If you go to the website and you click on the educator and doula tab that's across the top, and then click on classroom handouts, under the handouts, you'll find actually a growing number of free handouts, but one of them is the informed consent discussion sheet. And that can be given to doula clients. It can be given out in childbirth class, so that'll help to stimulate the discussion about this and help. So anybody have questions?